5 years ago, the world watched in horror as the COVID-19 pandemic swept across the globe. Now, a new threat emerges in China. The human Metapneumovirus, or HMPV, a respiratory illness with flu-like symptoms, is causing a surge in infections. The rapid spread of HMPV has sent shivers down spines worldwide. Countries are on high alert, closely monitoring the situation in China. One of the most concerning aspects of HMPV is the lack of readily available treatment options. Human Metapneumovirus, or HMPV, is a common respiratory virus that can cause symptoms similar to the common cold and influenza. It spreads through coughing, sneezing, or close contact with an infected person. The global health community is watching the situation in China closely. HMPV, or human metapneumovirus, presents itself with a familiar set of symptoms, often mirroring the flu or a common cold. These can include a persistent cough, a nagging reminder of the virus's presence; fever, a signal that the body is engaged in a battle against the infection; nasal congestion, making breathing feel labored and uncomfortable; sore throat, a constant irritation that can make swallowing difficult; in some cases, shortness of breath, a concerning sign of the virus's impact on the respiratory system. While most HMPV infections are relatively mild, the virus can have serious consequences for some individuals. In severe cases, HMPV can lead to complications such as bronchiolitis and inflammation to the small airways in the lungs. In more serious instances, HMPV can even progress to pneumonia, a potentially life-threatening infection of the lungs. Individuals with existing conditions like asthma or chronic obstructive pulmonary disease, COPD, may experience flare-ups of their symptoms. Firstly, hand hygiene is important. Wash your hands thoroughly with soap and water for at least 20 seconds, especially after using the restroom, before eating, and after coughing or sneezing. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing. Consider wearing a mask in crowded public spaces, particularly during periods of increased respiratory illness transmission. Finally, minimize the transfer of germs by avoiding touching your eyes, nose, and mouth with unwashed hands. And perhaps most importantly, practice self-isolation if you are experiencing any symptoms of respiratory illness. This responsible action helps to prevent the spread of infection to others. Remember, while HMPV can cause some concern, most infections are mild and resolve on their own. However, it's crucial to prioritize your overall well-being. Focus on strengthening your immune system through a balanced diet, rich in fruits, vegetables, and whole foods. Prioritize adequate sleep, manage stress through practices like meditation or spending time in nature, and engage in regular physical activity. Thank you for joining me today. For more natural health tips and insights, subscribe to our channel. Remember to consult with a qualified healthcare professional for any health concerns. Stay healthy, stay informed, and stay naturally healthy.